Grieving the loss of Nancy Parker, we know that many people at home felt a strong connection to her, but also feel a sense of loss after waking up this morning as they did every morning, each and every morning with Nancy. And we have some tips on dealing with this grief, or grief that you might have in your life, from Dr. Reena Mehta, who was a frequent guest of Nancy's, and you said you felt like she was a friend.
She was a good friend in this short time that we've spent together, and this is a devastating loss that I think myself, along with the entire community, are learning how to deal with.
You know, one of the things that occurred to me too is the people who are older here in the newsroom, who had the tighter bond with her over a period of years, are obviously deeply affected. Some of those who are struck hardest are some of the younger people who perhaps don't have a lot of experience with death. They still have their moms and dads, they still have all their siblings, and I think there's an age issue here at times, individually.
Grief is tough. It's normal and it's a healthy thing to experience, but it is tough for all ages. It's not a single emotion, it's actually experiencing the whole emotional process when you lose a loved one, and it can take a lot of time.
Well, I live with a nurse, and I said shock, denial, anger, acceptance. She said, no, and there are 5 stages, and you have to know them for medical reasons. So let's run through them. Denial and isolation.
So the first stage of grief is denial and isolation. So this may be where someone feels fear or shock or numbness, where one may just completely cut you out from the world. The second stage of grief is anger. So this is when you may feel angry or anxiety. This is sometimes the most painful part of the grieving process. The third stage of grief is bargaining. So this is basically, you're trying to get meaning of losing a loved one. So what did that mean? And this may be where someone reaches out to you and tries to tell their story or tries to bring clarity to the situation. And then the fourth stage of grief is depression. So then when reality finally sits in, sometimes the feelings of depression, the feelings of emptiness and helplessness can really, really be a tough part to deal with.
And so you get to acceptance.
The final stage of grief is acceptance. And so this is finally, we're getting back to our daily life, and this is accepting that you have to do the daily life without that loved one.
And I guess both the mind health issue and a physical issue too is, I read that something like 7% of people do not get to that acceptance.
Exactly.
And you need to know that as a doctor.
So normal grief is thought to be temporary. You go through these stages, but within, a few weeks to months, you usually get better once you start resuming your daily life. About 7% of the population has an extreme reaction to grief, and this is called complicated grief, where they, cannot go on in their daily activities. They feel like, the world is ending and things like that. It's really important to recognize those patients, I would say, because they may need professional help. So whether that's counseling, whether that's seeing a mental health professional, whether that's seeing a psychiatrist, it's really important not to miss that category of patients who could be grieving.
Dr. Reena Mehta, who wanted to be here this morning to talk about Nancy, and we appreciate you coming by.
Thank you for having me. I know this is a tough process for everybody here at Fox 8, everybody in the community, and just so you know, joining a support group is a really great way to deal with grief. Seeking out to your loved ones and your family members, and if you're a religious person, going to your faith. And please, if you're feeling moments of grief, do not hesitate to reach for help.
Or when you lose someone in your life.
Yes.
All right. Thank
Absolutely.
you so much.
Thank you for having me.